Welcome to this Medical Appraisal Skills video workshop. This is one of a series of short films intended to explore some of the challenges presented by medical appraisal conversations, and to encourage you to consider helpful behaviours, strategies and mindsets for these important meetings. The purpose of this scene is to look at how we can support doctors to embrace quality improvement. Let's join our doctors mid-appraisal.
So, finishing off patient feedback, looking here, there's some really good positive comments.
Yeah, although some people have said that my communication isn't very good.
Okay, that's true. There are a few comments like that. Why do you think that is?
Well, probably because I'm not here very often.
So your communication can't be timely, I suppose?
Yeah, that's pretty fair.
Okay, so have you had a thought about maybe spending time reflecting on your approach to patients and the impact that you have?
Not really. I mean, I come in, I do my job, and then I go. It's not hugely satisfying.
Tell me more.
Notice that very simple prompt from the appraiser. Tell me more. This is one of several quite useful phrases to consider using in these conversations, which can be remembered as TED. Tell me, explain, describe.
Tell me more.
Well, I work in isolation a lot. I do 2 days a week. I come in, I do my job, and then I go, like I said. I suppose I can understand why patients feel that my communication isn't very timely, because if they have results or if they're waiting for test results, they have to wait until I'm next in. And I can understand that can be frustrating.
So how do the partners manage that? Because they must have the same issues.
The partners, I don't really communicate with the partners about this. If the test result is urgent, I might inform the receptionist to keep an eye out for them, or the lab might call the surgery directly. But I don't really speak to the partners about that.
I'm worried about this doctor's lack of engagement. There is obviously no support.
Take a moment now to discuss how you can help a doctor who appears to be isolated. Let's see how our appraiser handles this.
So there doesn't seem to be any system in place there. It does seem as if you are working on your own a lot. How do you feel about that?
Yeah, I am working alone a lot. I feel that I'm, like I said, isolated. It's hard. I don't feel engaged with the surgery and the practice, really. I come in, do my bit, and I don't know if I really have any right to be engaged or to ask people for things, because everyone is busy and everyone has their own patients.
I think you absolutely do have a right. It sounds to me that the issue is around support, that you don't feel supportive and therefore you don't have the confidence to ask for what you need. Where do you think you could get that support?
Well, I suppose there are other sessional GPs working in the practice. I've never had a conversation with them. Maybe they feel the same way that I do. I don't know. That might be a good place to start, is to have a conversation with them and find out how we might be able to support each other.
I think that's a great idea, because if you buddy up possibly with one or two other people, then you can actively check each other's messages and hopefully that will improve communication with patients.
Good point.
Anywhere else you can find support within the practice?
Apart from the receptionist, honestly speaking, I probably should have a conversation with the partners. I probably should find that engagement and share best practice, because of course I experience things being a sessional GP that they might not experience, and vice versa, and to ask them for their expertise. I just need to go ahead and do that.
I think it's really important that you do that. Obviously, discussing working practice with the partners, I think, is something that's incredibly worthwhile for you to do. You talk about communication with your patients, and we have some evidence of that. And I think any failures there may be a reflection, to some extent, on the communication between you and the partners, actually.
Good point.
So I wonder if we can focus a bit on that, or you can focus a bit on that, if we would see an impact on your relationship with the patients.
Yeah, it'd be interesting to know in a year's time if the patients feel differently once I have these conversations. I mean, they're not easy conversations to have because everyone's busy and I don't want to take up anyone's time. But like you said, I think we've reached a point where it's important to have that conversation for me, to find that engagement again.
Well, let's make this a QI item on your PDP.
Okay.
So we can look at getting some patient feedback again in a year's time.
Okay.
Because if you get that support network in place and start having case reviews with the partners, I think you will see some interesting developments in that area. And also make sure that you are doing those case reviews and best practice with the partners. That's another QI item that we can put down there.
Okay.
Great. Let's itemise that on your PDP when we've got to the end of this session.
Okay.
And see what else we can also include on that.
Okay.
Okay, good.
Mm-hmm.
Further information on quality improvement can be found on the GMC and the Royal College's websites. Finally, based on your discussions with your colleagues and what you've learned through watching this film, what are some helpful ground rules or tips for these conversations?